Hello, and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of the MRCP within the last 5 years and want to help you do the same. We're not associated with any MRCP examination organizations, and the materials covered are by no means an exhaustive list of what can come up in your exam, and indeed are not intended to be used as medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is on Shigella species under the section of infectious diseases. So this is a picture of Shigella, which is, as previously mentioned, not extremely common for the MRCP exam to ask you to identify the bacteria based on their slide. However, they are completely within their rights to do so. So I would personally recommend that you have a broad understanding of what these different bacteria may look like under the microscope. So test day comes and you would be able to have an educated guess at least. The epidemiology of Shigella is that it's more common in developing world. Risk factors include young age, malnourishment, crowded living conditions, and inadequate sanitation. Shigella's pathophysiology is that it is a gram-negative, a facultative anaerobic, non-motile bacterium. It is closely related to E. coli. It is transmitted through the fecal-oral route, and it can invade the intestinal epithelium, escaping phagosomes, and then multiplies within the cytoplasm and eventually spreads intracellularly. Large virulence plasmid encodes essential genes for invasion and spread, which is how it can potentially cause severe disease. There are four species of Shigella. These include Shigella dysenteria, Shigella flexneri, Shigella boydii, and Shigella sonnei. The clinical manifestation of it is that it is primarily a cause of bacillary dysentery or shigellosis, which cause severe abdominal pain, diarrhea, and fever. Shigellosis can range from mild watery diarrhea to severe bloody diarrhea, which is where the word dysentery comes from. There are certainly potential complications which would happen as a result of ongoing diarrhea. These include dehydration, severe electrolyte imbalances. Very severely, it could cause hemolytic uremic syndrome or HUS, especially in the case of infection with Shigella dysentery type 1. It can lead to reactive arthritis in rare cases. If you want a refresher of reactive arthritis, there is a complete video on this under the section of rheumatology. And if you can click here, you would be linked directly to that post. The management of Shigella is normally supportive and it can usually self-terminate and not require any antibiotics. However, patients do need to be supported with rehydration therapy and be taking antipyretics for fever and pain. Needless to say that reduction of infection through improved sanitation, hand washing, and safe preparation of food is really important to try to stop spreading the disease. Let's do some questions. During a public health investigation, an outbreak of Shigella dysentery is identified in a community with limited access to clean water. Which of the following interventions is most likely to reduce the spread of the infection in this community? A. Mass vaccination of the community against Shigella. B. Distribution of oral rehydration solution. C. Provision of clean water supplies and promoting hand hygiene. D. Quarantine of affected individuals. E. Increasing the dose of chlorine in the local water treatment facility. And if you were paying attention during the talk, you will realize that most of the cases of Shigella are actually self-terminating and do not require any antibiotic. However, to stop the spread of this, it would be really important to stick to the basis of management of infectious diseases, which would be option C, which is provision of clean water supply and also promoting hand hygiene. Thanks for listening to this episode of Bite Size MRCP. If you like what you heard today, give us a thumbs up and hit the like and subscribe button to make sure that you don't miss out on our next episode. Let us know in the comments which topics you would like to hear in the future. See you in the next episode.